Hi guys, it's your next door nurse Florence and you're welcome to my channel where we talk all about emergency health and wellness tips. In today's video, we're going to be talking about hypertension. We're going to be talking about what it is, its signs and symptoms, its causes, the risk factors, its complications, its prevention and management. Don't go away. Hypertension is another name for high blood pressure or raised blood pressure. It is when your blood pressure is persistently too high or when your blood pressure is consistently too high. Blood is carried from the heart to all parts of the body in the vessels, that's the arteries. Each time the heart beats, it pumps blood into the vessels. Blood pressure is the measure of force that your heart uses to pump blood around your body. It is written as two numbers. The first, that's the systolic or the top number, represents the pressure in the blood vessels when the heart contracts or beats. The second, that's the diastolic or the bottom number, represents the pressure in the blood vessels when the heart rests between beats, and it is measured in millimeters of mercury. A normal blood pressure is a pressure below 120/80 millimeter of mercury and above 90/60 millimeter of mercury in an adult. Hypertension is diagnosed if when it is measured in 2 different days, the systolic pressure on both days is greater than or equal to 140 millimeter of mercury, and the diastolic blood pressure reading on both days is greater than or equal to 90 millimeter of mercury. The cause of hypertension is often not known. In many cases, it could be as a result of an underlying condition. There are 2 types of hypertension: the primary or essential hypertension and the secondary hypertension. Primary or essential hypertension is a type of hypertension that is not due to an underlying medical condition, while secondary hypertension is caused by an underlying medical condition. Primary or essential hypertension can result from multiple factors, including blood plasma volume, hormone activity in people who manage blood volume or pressure using medication, environmental factors such as stress or lack of exercises. Secondary hypertension has specific causes and is a complication of another problem. Conditions that can lead to secondary hypertension includes 1. Chronic kidney disease, which is one of the most common causes of hypertension. As the kidneys no longer filter out fluids, the excess fluids could lead to hypertension. 2. Diabetes mellitus, which is due to kidney problem and nerve damage. 3. Pheochromocytoma, a rare cancer of the adrenal gland. 4. Cushing's syndrome that corticosteroid drugs can cause. 5. Congenital adrenal hyperplasia, a disorder of cortisol-secreting adrenal glands. 6. Hyperparathyroidism, which affects the calcium and phosphorus levels. 7. Pregnancy. 8. Sleep apnea. 9. Obesity. The risk factors of hypertension include the modifiable and non-modifiable risk factors. The non-modifiable risk factors include 1. Age, more common in people who are 60 years or older because blood pressure can increase steadily with age as the arteries stiffen and narrow due to plaque buildup. 2. Ethnicity. Some ethnic groups are more prone to hypertension than others. African Americans have a higher risk than other ethnic groups. 3. Sex. Males have a higher risk of developing hypertension than females. However, this is only until after women reach menopause. The modifiable risk factors include 1. Alcohol and tobacco use. Regularly consuming large quantities of alcohol or tobacco can result in hypertension. 2. Sedentary lifestyle. 3. Low potassium intake. 4. Poorly managed stress. 5. Physical inactivity. 6. Unhealthy diets. Excessive consumption of salt. A diet high in saturated and trans fats, and low intake of fruits and vegetables. Hypertension is called a silent killer. Most people with it are unaware of the problem because it may have no warning signs or symptoms. It is vital to measure blood pressure regularly. When symptoms do occur, they could include early morning headaches, vision changes, nosebleeds, irregular heart rhythms, and buzzing in the ear. Severe raised blood pressure can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. The only way to detect hypertension or raised blood pressure is to measure the blood pressure with a sphygmomanometer and get it interpreted by a health professional, either your physician or a nurse. High blood pressure can cause serious damage to the heart. Excessive pressure can harden arteries, decreasing the flow of blood and oxygen to the heart. This elevated pressure and reduced blood flow can cause 1. Chest pain, also called angina. 2. Heart attack, which occurs when the blood supply to the heart is blocked and the heart muscle cells die from lack of oxygen. The longer the blood flow is blocked, the greater the damage to the heart. 3. Heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital organs in the body. 4. Irregular heartbeats, which can lead to a sudden death. 5. Stroke, which occurs when an artery gets blocked or bursts. 6. Kidney damage, leading to kidney failure. 7. Aneurysm, or abnormal bulge in the wall of the artery that can burst. 8. Amputation. 9. Hypertensive retinopathies in the eye, which can lead to blindness. Regular blood pressure monitoring can help people avoid these severe complications. Reducing high blood pressure or hypertension can help prevent heart attack, kidney damage, stroke, as well as other health problems. Prevention includes reducing salt intake, regular exercises like jogging, walking, swimming, and cycling, eating more fruits and vegetables, being physically active on a regular basis, avoiding use of tobacco, reducing alcohol consumption, reducing or eliminating the intake of foods high in trans fats or saturated fats in your diet. The management of hypertension includes 1. Stress reduction. Avoid or learn how to manage your stress. Some of the ways to manage your stress includes meditation, yoga, warm baths, and going for long walks. 2. Medication. Choice of medication depends on the individual and any underlying medical conditions that they may experience. Eventually, people with hypertension will need to combine 2 or more drugs to manage their blood pressure. 3. Diet. Follow a heart-healthy diet. Reduce salt intake. Eat more fruits and vegetables. 4. Regularly check blood pressure. 5. Treat high blood pressure. 6. Manage other medical conditions that can result in high blood pressure or hypertension. So guys, give me a thumbs up if you find this content helpful and useful. Please subscribe to my channel for free. Click on the notification bell so you'll be the first to know when I upload new videos. You can drop your comments or questions in the comment section below and I'll attend to them. I'm still your next door nurse and I'm just a knock away. I love you guys. See you in my next video.